we're having issues with knee pain as we're going up steps, we've got a couple little points we can get into to see if we can get some immediate pain relief and start patterning a better movement to take some of the pressure off and let it calm down. So as we go up onto a step, the first thing we want to see is, do we immediately kind of throw our weight forward onto our toes and into our knee, or do we push up more cleanly through the middle of the foot? So when we go up to a step, if our first inclination is to kind of like lunge forward like this and load into it, we're loading this myofascial sling with the patella in the middle across to do most of the work. A lot of times it's going to be a tension pattern. The tightness of the quad and hip flexor is going to help you bounce up. It's not really using your strength as much. And that's going to give us a huge compressive penalty at the kneecap and put a little extra more work on the front side, which is generally how most people are dominant and what we're going to work on with all the glute stuff and everything else. So when we go into so as we go onto the step, the way we want to think of it a little bit differently is, instead of going more forward and riding the momentum, is I want to be able to almost push like a little bit more through my heel and drive up back through my hip through the posterior chain, which is more glute, hamstring, and like calf, to see if I can push to this step, can actually be like semi-balanced at the top and then come back down a bit or keep going up. If I can't hold a little bit of that stability, I'm going to use this as a crutch to just bounce off and kind of go up, but we're going to have that penalty at the knee as a result. So as we set up onto a step, the foot's down, I want to think I'm going to put like almost a little bit of pressure through my heel, even though it's not on the ground. And I want to think I'm going to feel the drive from my hip, like so, to kind of push through, rather than bouncing forward off the knee. So as I get up into here, the knee's going to kind of naturally straighten. You're still going to use a little bit of quad, but most of the work is going to happen from this backside. That'll take a little bit of pressure off the knee, and if we can get this to start being automatic, that's going to help us strengthen a lot of the weak musculature on the backside leg, which we're going to be rehabbing. So every time you go up a set of steps, every time you go up an incline, it's going to contribute to building up the strength and endurance you need to get better and stay better. Hope that helps. Have a good one.